Depression, your brain, and the screen. I'm Dr. Trish Leigh. Let's break it down. In this video, let's talk about 3 things. Number 1, what is depression? The symptoms and how is it impacting your life? Number 2, what causes depression and how is screen time related? And of course, number 3, your brain tip strategy so that you can feel better. Today, your brain tip strategy, I have 2. One that is a high-tech, advanced technology solution, and the other that is low-tech. So stay with me until the end. Okay, number 1, we're talking about depression because it is the leading reason for disability worldwide, and it's impacting hundreds of millions of people of all ages, and screen time is not contributing in a positive way to that number. That's why I'm here. But first, let's talk about what is depression. Depression is that feeling of pervasive pessimism. It's that persistent feeling of worthlessness and hopelessness and helplessness that many people have. It's lack of self-worth. It's increased pain, mental and physical, feelings of guilt, difficulty concentrating, lack of motivation, and even difficulty with activities of daily living. If you have a brain that's stuck in depression mode, it's impacting you in all the important ways. What people should have in their lives is happiness, joy, and peace. Depression is the opposite. Many times it's coupled by anxiety, and it's the swinging between feeling depressed or being overly anxious. And in that case, your brain is swinging back and forth, or it can just show up all by itself. And screen time is contributing. So what I want you to know is there's ways to improve your depression, and we're gonna get to them in a second. But let's think about this. Depression really is an evolutionary mechanism that's meant to protect you. It's a protective mechanism, and it works in this way. It's supposed to kick in when there's the threat of danger or defeat. So your brain and your body is immobilized to protect you from that danger. And of course, if that happens in one instance, but you're able to resolve that instance, you've used depression in a healthy way to protect you and help you survive and help you get back to happiness. But in today's life and society and the way that we live, there's so much chronic stress, and that chronic stress wears on the brain and the nervous system. And so now that threat or that feeling of danger or defeat is around all the time, especially if you're consuming social media a lot. We know that there's FOMO, the fear of missing out, or there's major comparison to other people's lives that make you feel defeated. And the screen is contributing to that aspect. So now your brain can't get out of this mode that was meant to be a short timer to get you back to happiness. Trauma's involved also. So if there's unresolved trauma from your past, your brain might be in a trauma response, which again is meant to protect you from trauma. But if you work with a coach or a therapist and you can resolve that trauma, let it move through your brain and your nervous system to get it out. That's not to pretend it didn't happen. That's to process it and interpret it and hopefully allow it to allow you to grow. And yes, that's optimism, but it's pragmatic optimism. It's doing what you need to grow and to learn from the negative experiences in your life. And we're gonna visit that in the brain tip. But that's a way that you can process those experiences and let them flow through you, not create neurorigidity in your brain that locks it in this depressive mode and keeps you down. So number 2 is, what does depression do to your brain? What it does is it locks it up, and it's meant to protect you, but you get locked in this mode and you can stay in it for months, years, decades, a lifetime. And if you're locked in this mode, it is your brain protecting you from processing something it doesn't know how to handle. So many times you need help with that. You need a coach or a therapist to help you move through experiences or dysfunctional dynamics, difficult decisions, process that with someone to help unlock your brain, create neuroplasticity so that you can move forward with more joy and with more happiness and more peace. So what happens in a depression brain pattern is the power is actually knocked low. It's a low power brain, and that keeps you from processing anything that you can't handle. At the same time, your brain slows down, and it's different from ADHD. ADHD is theta. Depression is a lot, high use, high magnitude, a lot of the use of alpha, which I usually characterize as couch mode and that chill mode. But if it's being used so much and it's extra slow in its frequency, now you're stuck on the couch mode, which is not a good place to be. So the goal is to power up the brain and to increase the fastness of alpha so you can get back to feeling calm and focused using more low beta, which brings us to our brain tip. Your brain tip for today, the high-tech version, is to get the Muse headband. And if it's in the cards, join my Brain Training 101 program. It's only $49. And actually, I'll give you a coupon code that we have in my back pocket. It's Trish10 for another 10% off. It's a low investment if you can afford it. And the headband, the link on this video, it's a 15% off link for the headband that uses neurofeedback brain training to optimize that speed and to boost the power in your brain and to speed it up. But remember, when you speed it up, the information or the experience that needs to be resolved is going to be there for you to chew on, to interpret, to process, and to resolve and get out of your nervous system. So you might need a coach too, or a therapist, someone to move through that with. A trauma therapist would be great if you have trauma in your past. But now it'll be out of your nervous system and you'll feel so much better. Number two, lower tech, is to I encourage you to engage in meditation, slip of the tongue there. Medication is going to lower the power in your system. Maybe it was the universe helping me to shout this out to you. Medication, what it does is it lowers the power in your system so you don't feel those symptoms, but it doesn't help you resolve that pain that's inside. Meditation will create more neuroplasticity, but again, it's going to be there for the chewing on. So here's what you can do with that. Get your journal out, and I encourage you to write down the experiences that are lingering in your nervous system. Have the courage to put them on paper so you can look at them. And of course, if you have a coach to help you do it, it's going to be even more powerful. Then purify the past. Go through the necessary work and motions that you need to learn and grow from the very painful negative experiences. But what we're going to do is we're going to purify them and we're going to take the positive out of them. Again, it's not unicorns and rainbows and sunshine. It's looking at the past for what it was, but using it for your good so you can snap that brain pattern back into the healthier one so you can be happy. So when you do that historical dig and then you purify the past, you can anchor into the benefits of that experience for the rest of your life, and you can get back to happiness. Okay, that will help you out, but again, get somebody to help you so that you can process it with someone who's emotionally mature and trained. Okay, if you're looking for help on the journey, go on over to drtrishleigh.com, look for Brain Training 101, and as always, control your brain or it'll control you.